an instructor at UC Berkeley and also San Francisco City College. I teach health and wellness as well as Tai Chi for health and fitness. So my emphasis is not on competition. It is not on practicing form so much. Forms are important, but not the major part of my teaching. And since this class is for many acupuncturists and Chinese doctors, my goal is not necessarily to teach you another form. As I said, forms are okay, but they are not the major part of practice, especially if you're talking about health. So for health, we want to understand principles. So what principles make up what's Tai Chi? Number one. Number two, most importantly, what can we take from Tai Chi and Qigong to use for medicine? Now, in China, Tai Chi and Qigong are considered modalities of Chinese medicine. They're not just practices for martial artists or people interested in cultivating their spirit and things like that, but also it's part of preventative medicine. So there are many practices in Tai Chi that are important to preserving people's health. So I want to talk a little bit about those things today and give you some actual techniques you can use. At the very end of this class, we will introduce the Sun Tai Chi form. So this is a simple form, only 6 moves, designed by Dr. Paul Lam. And Dr. Paul Lam is from Australia. He has done 15 years of clinical study to curate different styles of Tai Chi and to find out which movements will benefit people's health the most. Through his study, he verified that Sun style Tai Chi, in terms of health and wellness, works the best. Okay, because it doesn't stress the body, it's easy to learn, but third thing is it's effective and the results can be verified through study and practice. Okay, so he's done it on thousands of patients and been able to come to these conclusions. So if there are questions about that, I can try and answer those at the end. But as I mentioned before, Sun style Tai Chi is the only style of Tai Chi recognized by the CDC today to either prevent or cure arthritis. Okay. It's also been shown to be effective in diabetes and also in weight control. Though, as I always mention, in weight control, you have to do more than just what we're going to be teaching. So we're teaching the basic form, which is good for everybody. And because the movements are easy and you're standing up, anyone in any physical condition can do it at any age. That cannot be said to be true for other styles. Okay, so that's why we kept it simple. So the requirements for the CDC is one, the movement must be simple. Two, it must be easy to learn. It also must do no harm, and it has to be data-driven proof to show that it works. Okay, so that's why we will be teaching parts of that. All right, so the other thing, we'll talk a little bit about Tai Chi Qigong because I think that's really important. But I'm going to begin today's lecture with something different. This is called Pai Dagong. Pai Dagong is something that my teacher, Grandmaster Feng, curated. These are from the practices of the Taoist monks. And so I haven't taught this in a long time, but we'll try and talk about how it's important. Early this year in Japan, they did a study on the fascia in the body. So as many of you may know, we have fascia running throughout the body. It's kind of a network of fibers, which for a long time scientists could not figure out what they do. But with the study done in Japan this year, what they found was these fibers, when they connect together, they allow chi and energy and liquids to move through the body. So they're important for transferring those things. And it is now the opinion of some of the scientists that that is the mechanism that we call the meridian system and channels. Okay, whether it's true or not, we don't know. Or whether that connects it together to allow the meridians and channels to actually connect together. So that's kind of interesting. The other thing is Tai Chi movements coil and turn. That allows the fibers in your body to knit together and join together. That allows circulation through the body. So they proved with a simple experiment, they found patients who had stiff necks and arms and could not move. They connected electricity through those points, and they were able to, after injecting both liquid and electricity through where it was tight, they're able to connect the fascia and get the stiffness to go away. So that was not even using needles, just electricity and liquid injected into it. So liquid moving through the fascia helps to create the circulation in the body. And so it is theorized now that the reason you have pain is because the fascia doesn't connect. Liquids can't transfer. The the muscles start rubbing together, creating inflammation, and that inflammation creates pain, and so it turns into an injury. So connecting the fascia is really important. So the easiest way to understand connecting the fascia, you can do it on yourself. You hold up your arm and you touch it. Now, if you press really hard, you can feel your bone. Okay? If you press too lightly, all you feel is your skin. But now you press just enough and then I'll push. You will note all of a sudden that your arm can actually move by merely rubbing your skin. And it's not because I'm rubbing my skin that it moves. It's because I actually connected to the fascia in my body, and by moving it, I'm able to connect the fascia. The fascia turns the body. Okay. So that's a simple experiment to kind of understand. You have fascia throughout the whole body. And so the purpose of the Pai Dagong, one of them, is to connect all the fascia throughout your body. Number one, activate the important points and meridians and channels so that the qi can flow. So all these things are accomplished through the practice of Pai Dagong. So I'm going to introduce some of it. Some of it you're not going to be able to see because I don't have a low enough camera, but I'll talk about a little bit. And then when we get to the lower body, you can watch it on Mason's feed to see how he's doing it. So the Pai Dagong starts from the top of the head and goes downward. And again, these are what we call tapping exercises in English. But as I said, there's not just tapping your skin. You're trying to connect to your fascia. So when you do these, you want to make sure you have solid contact with your body. So let me get started first. So you start from the head and go down. The whole thing would take maybe 20 minutes to half an hour to do. So I'm not going to do all the points, but I'm going to do most of the major ones so you get an idea what to practice. This you can teach to any of your patients. They can do it on their own. One, to tune their body. Two, to kind of improve their immune system. Three, to, like I said, improve the circulation, which in fact, then helps the whole body improve its health. Okay. So first, I'm going to start at the head. So the head, you have, everyone knows, a channel that goes down the center. We're going to start from the back of the head and you're going to tap forward. So when you tap, you're not just touching. You want to press with some pressure so that you can connect to the channel that runs across the top of your head. Okay. So that's number one. Then you start at the side of the ear and also do that and go to the back. Hand connects to the back of your head. So here are the two muscles here. In between is the blood vessel that goes to the brain. You want to massage that to get the qi and the blood moving into the brain. That helps to wake you up. Okay. Next, we're going to deal with the ears. The ears now can help you. This is said to help with depression. You're kind of moody and you're kind of down. This is quite good for it. So you're going to cover your ears and we're going to tap the skull first, and then we're going to snap our fingers. So cover your ears. Okay, and now tap the skull. Next, snap the fingers. Then press in, push out, press in, push out. Do it about 3 times. Okay. Then you grab the ears. You're going to activate all the ear acupuncture points. So you rub along the outer rim of your ear about 6 to 9 times. Then the inside of the ear right here, you see the little knob right here where my ear is. You're going to grab that and activate it. That's your, again, your ear acupuncture point. It's kind of good for everything. Okay. Then grab the bottom lobe of your ear and pull down. Next is for the back of the neck. Okay, so you're going to rub the back of the neck. That loosens those muscles up, helps with tight shoulders, helps move your energy around your body. Okay. Next, you go to the skull, the head, and the chin and rub. Again, this helps to relax the face muscles. It's said to keep you young. Okay, so you can suggest that to patients. Next thing, you find the temple point and you rub that. That helps to relieve headaches and things like that. Okay. Next, for your sinuses, you want to rub inside the nose, up and down. Okay. And that's really good. All right. All right. So that's basically most of the head things that we're going to do. Then you move down to your lower part of your body. Okay. And so we're going to start with your arm. You start at the inside part of your arm here, this part, and you're going to hold your hands lightly and tap. But tap firmly again so you can connect to your fascia. Okay. How many times? About 20 times. Okay. So that's the first part. Part two, then you go to your arm here. So 3 fingers from your elbow, there's an acupuncture point here. Again, hold the hand lightly and tap. Bend the arm. Next part is the inside of the arm. So all your meridians and channels and your blood vessels and nervous system runs through this joint. By tapping them, you're able to activate all of them. Okay. Then the side of your arm. So your bicep is here, your tricep is here. In between is where the channel is. You want to tap in between there. Now this one is a little hard to find. It's the inside of your underarm here where the muscle is and the hollow space. Right here, there's a channel going through there. You're gonna kind of massage it, okay? That might hurt a little bit, okay? But that's what you're doing. You're plucking the tendons inside here, okay? And now to the other side. So you do the same thing, start at the inside of the wrist, okay? 3 fingers down from the elbow. Okay, again, the acupuncture point here, you're going to be tapping that. So using the edge of your hand. So some you use the edge of the hand, some you use the closed palm. Inside here, again, this is the edge of your hand, and you're tapping inside the crook of your arm. Okay. Then along the side of your arm, okay, out here, tap. Okay. Again, this is a relaxed hand, you're just tapping, but tap firmly again, so you contact the fascia in your body. Okay. Then, let me see, we did that one inside of the arm. Okay. Again, find those tendons under your arm. You're gonna lightly pluck them. Okay. All right. So that's that part of the body. Now we move to the center part of the body. You're going to clear out your central channel. So this is the renmai. So remember, this is for your digestion, elimination, circulation. So clearing it out clears out those systems. Very important. And then now rub the hands together. Touch the chest. Okay. This is for your lungs. Okay. So this you can do 2 or 3 times. But generally, you start this whole routine from the top to the bottom. You can skip exercises, but you always should do it, as I said, from the top of the head to the bottom. Okay. Now from here, you relax your arms, slowly circulate the qi around your chest. So you do about 9 circulations and then reverse. Okay. So for the next part, I'm going to turn it over to Mason a little bit, okay? Before I do that, though, you're going to put your hands on your dantian, tap the dantian. Okay, and then you're going to tap your kidneys and rub. Okay, so those you can see better on Mason's feed than mine. So Mason, for the next part, I'm going to say something and you do it, and then make sure that you say something so they can see in your feed and not me. Okay?
Don't worry. I'm a blabbermouth, so it's all good.
Yeah. All right. So we've done the kidneys, the dantian area. Okay. We've rubbed the back. Next, you're going to relax your arms. Okay. You're going to tap your sciatica, which is between the butt and the lower leg.
Yep. So you're gonna tap those areas and massage those points that kind of connect with your hips and your legs there, your femurs.
Okay. Then the next part, you're going to tap the inside of your thighs.
Yeah, you can make a gentle fist to do so. You can tap inside here.
Right. Or you can just use an open hand and tap.
Yep, open hand works too.
Yeah. For those of you older using a fist, you might bruise yourself. So for this one, you want to use open hand so you don't. But make sure, again, you're tapping firmly.
Mhm.
Okay. So that's the front of the inside of the thigh. Now do the back of the thighs.
Yep, so same thing. Open hand is good. I'm gonna make a gentle fist, so space between the hands. So back of the legs there, so you can see. Also have my handy dandy mirror. You can kind of see me from behind there. Yep.
Okay. Next, this is let me think. Okay, from your knee on the outside, you're gonna measure down 3 fingers. That's Susan Lee. That's the stomach and spleen point.
So we're just gonna tap there, or again, open hand or the gentle fist, tap there. On the outside, so you can see I'm doing outside of the knees. Kind of
Oh,
outside right there.
and then next behind the calf.
So I turn so you can kind of see. So there's my calf here. So I'm gonna tap there and here.
And so for this one, use a fist.
Yeah, it's a lot easier because then I'm gonna tap the top of my fist against the surface of my calf muscle there.
Okay, next your IT band on the side.
Mm-hmm.
So it's good for people who have cold feet and you get cramps at night. So I would recommend that for patients who have that kind of a problem.
Yep. So I'm just tapping outside there.
Okay, and then on next, I'm going to tap down from the outside on the out inseam of the leg an outseam of the leg and then come up the inseam.
Yep. So I'm going to start up here. I'm going to do open hand all the way down to my feet. Then I tap the inside, coming back up. And do that down again. Back up. Okay.
Okay, then the next one, we're gonna tap down the front of your legs, including your toes, and then up the back.
Yeah. When I get to my toes, I might make a gentle fist so I can have a little more leverage for how I'm tapping there. But I'm going to do open hand coming down. And here again, tapping my toes, kind of the bridge of the feet, and the back side of my legs. So again, down the front, tap the toes, sides of my feet, back around. One more time down. All right, good.
All right. Next, so this is a little different. This one, you're going to breathe in, raise your hands up and up on your toes. And now you're up on your toes, relax, drop your hands. So again, bring your hands in, okay? Go up on your toes with your hands up, turn it down, and then drop your hands down. Okay, Mason, you kind of got that? Yeah. Right.
Up. Yeah.
Oh, curve up first. So the hands are here. You come in, then go up. So curl in, go up, and then drop.
So curl in. Down. Curl. So rotate. So you want us to move the fascia network, if that works, right?
Yep.
Okay, so that's why you're rotating. So the hands are, if you're getting a little lost, my hands go in together, they rotate out. See how they turn? Okay, and okay, one more up. Okay, so go back to you.
All right. The next one is a little hard to demonstrate. So we went in this way to go up. I'm now going to go the other way, turn it back, go up and drop. Okay, so again, I went this way to go up the first time. This time is the reverse. I flip the arms over, push up on my toes, and then drop down.
Yep. So I'll do it here so you can kind of see me in the reflection as well. The hands are going to rotate in like this. Kind of go behind you. So you're kind of doing like this motion where it scoops in this way, comes in, unfold out, and then you come back. Now remember, as you do so I can relax, my elbows down, I return back to this position, extend up onto the balls of the feet, and then down. Okay. So rotate. Turn the hands over so the elbows are down, extend, down. Okay. Like that, Sibu?
Yes.
Yep. So that make sure that that's coming through the camera, right? And then the benefits of being able to have my separate mats there, folks, you can kind of tell. As I relax the elbows, I extend up onto the balls of the feet, and then down. One more time. In, around, relax. And normally as you come forward, you just unfurl your arms, you return back to this position where the palms are up, extend up onto the balls of the feet, and then, okay, so go back to you.
All right. Very good. So that is the basic Pai Gong routine. There are more techniques, but that is more than enough for most people. And as I said, the benefit of this exercise, so that took about 15 to 20 minutes to do. It loosens up the body, connects all the tissues, it softens the body so the chi and energy can move. So, an important exercise to do. And as I said, you can recommend parts of this to your patients if you have patients who have these problems. So, as I said, there's something for everybody in this set of exercises. So it's called Pai Gong. This is curated by my teacher from many of the Taoist practices of the Taoist monks. Okay, so I hope you make use of that in your practice, any of it. Okay, so remember, for health, is not necessary to learn a form, but it's necessary to learn some techniques that you can use that can help improve the patient or your own health. And so these are considered them as a whole tool set, okay, that you can use. All right, from here, we're going to move on to the next topic, which is now Tai Chi Qigong. So I'm going to introduce two of the exercises that we've been using lately. This is to move the qi throughout your body and also to feel the qi. Now, so the goal of Tai Chi Qigong is to help the student understand and feel qi, learn to lead the qi to their limbs, open up the 12 primary channels, loosen up the internal muscles, okay? And so those basic things prepare you to do Tai Chi. And these utilizes the principles of Tai Chi, meaning yin and yang. So if something goes up, something has to go down. So if my hands are going up, my body has to be going down. If my body is coming up, the hands have to go down. So these set of exercises illustrate this. Now, it's important you remember the student or patient or yourself needs to bend your knees when you're doing it. This allows you to use your legs as your second heart. And so it then acts as a pump, pumping the chi and blood from your feet back to your heart. This increases your heart efficiency. Okay. One of my students, he wrote his master thesis specifically on this application of Tai Chi. And so he had did experiments with the patients and has written his master's thesis on this. And so this is an application of some of those ideas. So the first one is bringing the chi from heaven to you. So for this, you're going to bend your knees as your hands go up. So right now I'm standing here. As my hands go up, I'm going down. Cross the hands in front of you. And now from here, imagine your hands are very heavy. Push down, float yourself up. Okay. Again, try that again. Go up. Let your hands fall now. You're not using your arms. You're just letting it fall. You're not doing anything. The lifting part, you're not even lifting it. As you sink, your arms are going up, kind of like you're in water. And as the hands are going down, you're floating back up. So this buoyancy is an example of yin and yang and also of Tai Chi. You're now moving Chi, not using your arms and your legs, but you're actually using your internal breath and the movement of your Chi to move your body. All right, let's follow Mason. So keep in mind, in the beginning, it may be just a physical exercise. As you get better, the feeling of the Chi will become stronger.
And to also just remind people as we go through these exercises, because we fully acknowledge that you've been probably in the sessions yesterday, saw our lovely recording, but also see us today. Ask questions and like really think about these, especially how you're going to be sharing them with your clients. Because remember, we want you to feel this so that you can help your clients feel it. These exercises are going to make a lot more sense when you can also feel these as we go. So as we do this one, I'll explain a little bit of what I feel. So as I relax, I feel myself sink, I release all that tension downwards. As the hands goes up. Now, as I cross, my hands come down, but I float back up. What I'm feeling is my intention, my yi, come up from the earth dantian to my astral. And I feel that kind of feeling of my intention rising. It helps draw energy back in. So it's very rejuvenating. So I'm going to sink, my hands come up. As I cross, I go down, I rise back up to a standing Zhongzhong position. And I feel myself pull fresh energy in, so it helps replenish again everything that's here. So everything through the torso up through the central meridians. Sink, lay everything down, tension and stress, anxieties. Allow yourself to rejuvenate, replenish, and recover back as you come back up. Let's do 3 more together. And again, think about how you can introduce this with your clients. and think about situations where it will be useful because again, every person is going to be different, as you know. So you must cater to your patient's needs. What are they capable of doing, and what are they you trying to help them achieve? Okay, very good. With that being said, Steve, we're back to you.
So that drew chi from above you. So drawing chi from heaven. The next one, I'm going to draw chi from the earth. So this one is the opposite of the first one. So have your hands in front of your dantian area, right below your navel. I have my right hand on top. It can be left hand, it doesn't matter. Like I'm cradling something. As I sink, I'm going to make my arms come together and go up. I'm going to separate, and now I drop my hands down and I float back up. So now you're going to feel the energy, the chi, coming up from the ground. So this is ground chi you're drawing. Earlier we drew heaven's chi. So there are three major chis, right? Heaven, earth, and ourselves. So we're using heaven and earth's chi to nourish our own chi. So again, start with your hands in front. As you sink, the arms come up. You just kind of slide them together and raise them. And then you separate. Take your time. As you separate, don't move anywhere yet. And then as you press down, float up. All right. So let's follow Mason now.
So again, that was drawing energy from heaven. Now this is drawing energy from the earth. So I'm going to sink, hands go up. They're going to be over the head. They separate. As the hands push down, rise back up, straighten the legs back into a standing position to return back to your neutral state or standing Janjong position. Okay. So as I go, again, what I'm feeling is I release down and drawing back up, relax the arms. I let my body help kind of like a magnet draw fresh energy back in from the ground, the earth. So I relax, sink, and I return back up, realigning myself. You can also try this with your breath. Just again, keep in mind breath. You can mostly do all the exercises just breathing normally. Okay. Especially for people who might have shortness of breath. But you can do it with your breath is one way. It's not the only way. So I like to breathe in. I breathe out. Keep the tongue pressed against the roof of my mouth. Turn back to my standing Jongno position. Breathe in. Breathe out. Let's do one more time. Good. All right, Steve, back to you.
Yeah, so briefly, you might ask, well, what's it good for? Well, these two exercises are good. One for the heart. Okay, as I said, you're using your legs as your second heart, so you're increasing the circulation through the legs. So for patients who have edema, okay, they have collection of water and fluids in their legs. This will help improve that circulation so that it will generally improve their health. Okay, and the heart won't have to work so hard. The other thing that these are good for is in strengthens your immune system and also all the 12 primary channels, meaning that your organs, everything, you're improving the chi circulation and flow through those organs. They can do their job better. They can heal your body. Okay, so these are generally good for everyone. Number two, the breathing exercises, because there's breath involved here, good for someone who has asthma, emphysema, and allergies. Okay, so don't think that these exercises don't do anything. They do. Okay, the other thing to realize, they should be done slowly and with intention. You cannot do these things fast, okay? Because you're trying to also what? Feel the energy. When you can feel the energy, then you actually know that what you're doing is actually working, okay? It's much harder if you're going fast to concentrate on your chi. So here you're trying to concentrate on the chi and song the entire body. Okay. Next is for your immune system specifically. Okay. And this is the Big Mo Pangon. So Big Mo Pangon, we're going to activate your astral or your heart energy as well as your lower dantian energy. Okay. So the hands start at where your heart is. Okay. You slowly turn, don't move your legs or your hips. You can't turn any farther. Bring the hands close to the daimai, which is your belt meridian. Slowly turn. Imagine activating your daimai as you turn. Then stretch the hands back out, expand, and now connect again to the heart, which is the point is tanzong. Okay. Then bring it back and turn. So let's follow Mason. This is the big Mo Gong. Again, this is for your immune system. It activates your Wei Qi and also your kidney Qi. All important.
Yep. It also travels through two different dantians, the astral and your earth, or your heart and like dantians. So I'm gonna go up, draw in into the kidneys, follow again the belt meridian across and back up. I mean, as many of you again are going to be thinking about your practice. I know this from my own personal uh, experience and anecdotal experience from actually my significant other. When you do acupuncture, of course, you're going to be dealing with a lot of people's energies. And if you're not aware of it or not taking care of it, the energy you are dealing with might affect your energy. And some of you might already have experienced this. Some of you might be not sure what that means. You don't have to think that far from a good, like even just an analogy from like other areas of clinical work, like PT. Surrounding yourself with a lot of negative energy, you might have someone who's really negative, it will affect your day. You know, you have a negative person, you might feel negative afterwards. So just like dealing with that and negativity, working with someone's energy as an acupuncturist, helping them, of course, you will be essentially diving into their energy. And it's important for you to be able to recycle that, process it properly. So this will help a ton for your own self, but also for when you may want to show people. Let's go the other direction though now. Because everything we're going to make sure that you have both the yin and yang, left and right, and allow yourself to properly move both sides of the body. So let's move the other direction. Up, level my tonjo, back down to the earth, dantian. So it's very important that you not neglect your own well-being while trying to help other people. So this might be helpful for your clients. Should definitely start by being helpful for you. Bring it down. And again, Prof.Fong and I both come from, again, yes, a martial background, but remember, there's a holistic aspect of where all these things meet. So what hopefully we're sharing with you can help with your medical and clinical help for other people. Okay. Let's do one more together. So up, expand, heal again from up here, your astral dantian down to the earth. Okay, very good. Stephen, back to you. And as always, thanks for letting me have a little anecdotal addition on there.
Again, as I mentioned before, my teacher mentioned that this is important not only for your patient's health, but for your own. And so he told me that if you're just practicing Tai Chi for one aspect, like competition or exercise, it's okay. But to get the benefits out of Tai Chi, the Qigong is one of the main things you need to practice. That plus what we call the Dansha practice, which is individual form practice. This is where you deal with the different energies, and it's so important to both your own health and your patient. So remember, these things are for you, to help you, but also things that you can also prescribe to your patients. 99% of acupuncturists I've asked have practiced Tai Chi, but none of them prescribe Tai Chi. Okay, and the question is, well, what do I prescribe? How do I prescribe it? Do I teach them a form? No, you don't teach them a form. You do what we have been doing. You work on the basic principles that help to enhance their life. So the next one that's important, we're going to do two different variations. This is 开合功, opening and closing. So the simplest one is well, I shouldn't say the simplest one. It's the small one, okay? You're going to start with your hands next to you. The elbow, say I can't get back any farther, are touching your ribs. And you're going to breathe in. Imagine this is a ball and you blew it up. And now as you exhale, you press it in. Also, what happens is my back is hollow here and round, the back is rounded. When I breathe in, watch my body. You notice it straightens up completely, and then as I close, the body closes. Now, two things happen that you'll need to notice. Watch it on Mason's feet. When I blow the balloon up, my body straightens, my legs close, they come together. When I close the top, the legs open. So the top and bottom of my body, one part is closing, one part is open. This creates a yin and yang dichotomy, which causes the chi to flow. Okay. And so when you're practicing this, you're practicing Tai Chi in its most basic form. Okay. And this then pumps chi through where? The central meridian. Okay. Through your through the Renmai and Dumai. Okay. So that's kind of important. And when the chi is smoothly moving through that, generally you can improve your own health. Okay. So again, you want to make sure that your elbows do not flare. So when you're doing it incorrectly and you're using your arms, watch my elbows. Okay. You'll see space here. This is incorrect. When I do it, you notice my elbows did not move anywhere. Only the forearm moved. Okay. As I breathe in, the expansion of the rib cage from my lungs pushes the hands out. And when I exhale, the rib cage collapses and the hands come back together again. So the movement of this is internal, not external. Okay. So let's follow Mason doing the small 开合功.
All right. So from here, you open up and compress. Now notice it's not that my arms don't move at all, so don't feel like you have to compress them against your body. That's bad too. So make sure that you feel like there's a little like just breathable space between the arms where you're not tightening the body in. That's the other thing too. Okay? And again, as I expand, I bend my knees, legs just a little bit, and I return back to standing as I come back in. Now, for those interested in understanding the energy too as well, I'm also thinking about my Tanjong, my heart meridian point, the astral Dantian here. And allow myself to focus my attention, my yi, on the feeling of expanding here, but also expanding mentally, just awareness around my body here. As I return back to standing position. Okay. So I can expand. So that way we're not just doing it as a, follow the motion kind of exercise. You should be considering again what you're feeling. And that's, as I said before, I'm going to share what I'm feeling as I go. So I'm feeling myself fill that balloon, expand, but it's not again just between what's on my arms, but I also feel around my body, feel my awareness, my yi, my intention is expanding, and we're returning back to neutral. Let's do it one more time. Good. All right. Because then we're trying to help you with your mindfulness too, all tying back to your practice. Sibo, back to you.
So this exercise is very key to Tai Chi. As I said,
Question, Sifu Fong.
yes, yes,
Go ahead.
When we do the expansion, when we open the arm, does the knee go down or come back up?
okay. When the hands go out, okay, so you're here. When the hands go out, your knees go in. When the hands come in, your knees go out. Okay, so it's the opposite. The top is yin, the bottom is yang, and then the top becomes yang, the bottom becomes yin. That causes the flow of the qi through the both the big circulation and the small circulation. So you
Uh,
activate the two conveyor
yeah.
belts.
It might help too see if we can explain it. Like, are you? Do you want them when you say that? You mean like? I think you might have to explain if you're telling like bend the knees like this versus out like this.
Yes. So it is actually going outward
Mhm.
and inward. Okay. It's not exactly bending downward. The problem with bending downward is then you're actually physically trying to force your body into the ground. Not the same thing. You do that, you get the chi stuck in your knees. Okay, so it's not pushing straight down like this. It's actually gently allowing your legs to bow outward as you're doing this. Okay, so this opens, that closes. This closes, it opens up slightly. And keep in mind, my feet are not straight. They're slightly in a V. Okay. That makes sense? Okay. So these are
Yes, thank you, Sifu Fong.
okay. You're welcome. Yeah. If you have questions, please do make sure you ask.
Yeah, because I also fully acknowledge it. I am wearing baggy pants, so you can't really tell very easily. But just in summary again, as I expand, these knees kind of like I don't again necessarily bend the knees like here. It's more like my intention kind of draws in, like as Sipa said, as this goes, this is kind of going. So I kind of feel myself kind of like the inside of my legs kind of compressed as I go up. And as I come back in, they return back. They have to do the opposite. So it's like a opposite open and close motion going on here. Like that, right, Sibu?
Yes. So it is a pumping motion. So that is important to keep in mind because for the next one, we're going to do the same thing. But this is the big Kaiho Gong. This one, you bring your arms all the way out. But importantly, and I just realized that from the last session I was teaching, the arms here, the elbow doesn't move in this case, okay? When you breathe, the elbows still stay here. The arms move out, okay? So my elbows are still close to my body, and then I squeeze. But the same thing happens here. When I open, the legs close. When I squeeze in, the legs open. So this is big kaido gong. But this one, you're trying to feel the chi where? At the low gong, right in the middle of your hand. You can feel the hands heat up almost immediately. So Mason, let's take us through the big kaido gong.
Yeah. So in a sense, you bring your hands down to here, about the height of your diaphragm. Okay. And now expand. And this one goes for as long as your breath is going, you expand. The moment you're stop breathing, stop moving, and then breathe out. So I come back in. For example, that's just happened what I did. So I breathed in here. This is the max how much I can go. And then I breathe out back into the center. So same thing as my hands are going this way. I kind of feel the outside, like the outseam meridians here. As I expand, kind of compressing, I feel more of the inside here. So that way I have both my upper body and lower body engaged. Again, all for your development and awareness of your energy and to help, of course, cycle the energy through your body so you don't build up your own stagnation while working with clients. And of course, just the better you are sensing energy, of course, that's going to help your own ability to diagnose your clients and help them, right? I mean, that's the whole intention, yes? So and we work on that together. So sensitivity to the energy, sensitivity to the world around you, sensitivity to other people, all good things to exercise. Expand. Back. Let's do one more. It's the same thing. And again, it will be a little esoteric, but it has all the experiences behind it that we're helping share there with you. So follow along. We'll continue on with that. Steve, back to you.
Yeah, I forgot to mention one other thing too. So when you're doing this, you have to make sure that you tuck the bottom in slightly, pulling it up in the back. So that your back is not straight out and your chest is up, right? You have to round the bottom so that the top will also round too. So that's important. Now, the reason for that is important. If I stand up straight and I do this exercise, you can't feel anything in your abdomen because you're not actually connected to the lower dantian at all. Okay. Once you roll the bottom up though, and I'm doing this, you can now feel the dantian. Okay. Now I need to explain also the dantian in martial arts and in medicine is not the same. Okay. Dantian in medicine is the point below the navel. For the martial artist, the dantian is actually the lower abdominal muscles. Okay, so the word dantian, tian is a field, right? So this is the field, which is your lower abs. The dan is the energy that's buried inside the field. Okay, and you're trying to connect to the field so you can cultivate the dan inside the body. That's actually what you're doing. And so talking let me continue. We were discussing the role of, again, the body. The body acts like a pump. You open the top, you have to close the bottom. You open the bottom, you close the top. So, like I said, it acts like a pump for your energy. Each of these exercises makes use of those principles. The next one, we're going to do the nourishing of your different channels, and not channels, but of your dantians. So first one is your lower dantian, then we're going to do the upper dantian, and then we're going to do the uh, astral-dantian or the middle dantian, okay? So for the lower dantian, this is drawing chi from the earth. And again, you're going to have to watch Mason do this later, but as you breathe in, the arms come up, you relax, let them fall. Breathe in again, bring them up, and now this time you slowly bend your knees. Reach all the way down to the ground. Imagine closing your hand lightly, drawing the energy up the back of your legs, around your daimai, and then you relax your hands. Let the chi flow back into the ground. So this is draw chi from earth. Mason, you remember this one, yes?
Yep. So you circle once, down. Let your hands go around the legs. Now it helps to bend the knees. Let your hands come up. You can see my mirror around the kidneys. Back down there. Okay.
Okay, so you can also do this the hard way. As you go down, you bend your knees all the way down.
Yeah.
However, not every patient can do it that way, okay?
Right. Yeah.
So it depends on the patient.
Mm-hmm.
If you do it for yourself, I do suggest you bend your knees too.
Yeah. So that was the easier way. This is the hard way. So it's down. So circle 1, 2. I'm gonna bend now. Now I can get all the way down here. Some people won't be able to do that. And I'm gonna push off the ground. Get it up, the back, and down. Now, that can be a little intense for some people, and especially since it's a risk that people might lift doing this. Like lifting with their back instead of their legs. So that's why we caution people in doing the hard way. For you, or for someone who's trying to build leg strength, you have to teach them the right way to do it. So let's do it again. this way, I'm going to do it again. Circle 1. So again, focus on the low gun points of the palms. Down. So I'm actually going to keep my lower lumbar straight. Bend the knees. I get down to this position. I'm pretty far. I can go pretty far. Now, I'm going to get my knees and my ankles underneath my hips. My hips are back here. So I do that because I need to be able to reorient myself where I'm not going to push up with my back. I have to do it from my legs. So from here, I actually push outwards, so my butt kind of goes this way. And then now my knees and our ankles are aligned. So what I need to do, I need to get my hips over this. So I bring myself forwards. I push up off the legs. I'm like an accordion. Okay. Push up, and that hand follows this. And see how my hands essentially kind of follow the straight line here? They don't go out this way. They go. I get my hips and my back over the legs. Round the dime down. Again, that takes a bit of coordination. That's why the one I did earlier is just 1, 2. I just bend at the fold of my waist, and then you can see I actually push my knees out to the level of my toes at max. That then gets my hips underneath me, and then I come back around. That's it. So there's 2 different ways, but both have to end up with your ankles and your knees, your hips aligned, so you do not lift with just the back. Okay.
You can also do this without bending the legs at all.
At all, yes.
You need to use your intention, and you might want to prescribe that to patients who are quite old and have, harder time balancing and reaching it. You just reach down and come back up.
Yeah. So that one, circle 1. Again, focus on the low gun points. 2. I'm just going to bend my knees slightly, and I use my intention so my mind sinks. My hands come to the sides, and they're immediately going to just go behind my back. So like again, 8 points there. And I just straighten up. The hands go around again the melt meridian. And here. Yeah, let's do this again. I'm going to do all the way down though. So come forwards for you. So relax. Circle 1, 2. This one I'm going to go all the way down. Hands going to come behind the legs, essentially behind my ankles. I'm going to get my hips underneath me. Push up off the earth. The hands are going to continue up. Follow to the kidney points. Circle. Down. Good. Now I'm going to do the medium one. In, out, 1, 2. Go down. Now I get my knees again so that they don't go past the point of my toes. So you notice I don't go like this. I go here. So because I don't want to also do the opposite, which is put too much force forwards onto those knees. Bring the hands behind you. It's again, it says you're going up. So notice each time I push up off the ground from my legs. And the simplest, the one where I don't even bend. 1, 2. So circle. This one I just simply bend the knee slightly. My tension drops. Hands come behind me up to the kidney points. And it ends the same way. There you go. So 3 different levels, all based upon what's your client's capability.
Yeah, and I should mention, you can lightly close your hand into a fist. So you go down 1. As you go down the second time, imagine you're grabbing something from the ground and drawing it up. Okay, that's a perfectly good way to do that. Again, this helps to modify the person's intention, giving them a little focus for their mind and their energy. Now, the next one we're going to do is from heaven. So this one you reach up and you draw down. Okay. Again, reach up, draw the chi down, bring it down the central meridian, sink it to the bottom of your feet. Okay. So this is draw chi from heaven. The other one was draw chi from the earth. So let's follow Mason now.
E. All right, so let's give this a go. As my hands go up, similar to what we did before, as I sink, my hands rise. I grab. And it's still kind of some space between the palms. I'm not clenching the hands. I just close the hands. And you still have enough space, almost like you put a pencil between the hand. Back down. Once I reach again my diaphragm, I can relax my hands, bring to the sides. Okay. So all part of, we also call it our draw deep, degong. So drawing energy in, helping replenish your storehouse of energy. In, down. These will be very helpful, especially for the multitudes of your Silicon Valley clients who might be at a desk all day, or again, people who are just constantly sitting, stagnation, helping move energy. But even for people who move a lot, so on the other side, hopefully help them reset and coalesce their busy energy back into a stable state. Okay, very good. Sleep back to you.
All right. The next one, this is for your pineal, or if you like, for the brain, like you're stressed out, you're tired, you want to re-energize the mind, you need to refocus your mind because it's all scattered all over the place. So this is draw chi to the middle eye. So you reach out as far as you can, bring it toward the middle eye, and then sink it down. As you bring it out, open your eyes. As you bring it in, close it like halfway. Use your peripheral vision, follow the chi to the bottom of your legs. So this is drawing chi to the middle eye. Let's follow Mason.
Yep. As you're doing this, especially for those who are thinking about how to feel energy, your pineal, as all of you should know from your studies and from your work, is that center point in the middle of the brain. So third eye travels a little bit further in. You got your pineal gland. And for us, again, we're coming from Prof.Fong and I from the martial background, martial perspective. At the highest level, martial artists start with the physical, and they start developing their energy, and then they eventually develop awareness or spirituality, a higher sense of being that transcend this. Tai Chi is great because we focus entirely on that development and fast track that to be the first and foremost thing you develop. So for you as a client, what does this mean? Working with your clients, what does this mean? Why is it important? For you, working with acupuncture, like as a practice, you're going to be dealing with energy, same thing as before, but a little bit further is that the highest point that you want to get to, and the quicker you can develop it, the better. And developing that heavenly development, that awareness, the pineal gland, feeling that, knowing how to cultivate it is, of course, clearly one of the practices you should put into regularly for yourself. Depending on your client, you might be saying you can introduce them to. Could be very good especially for people who are dealing with trauma, anxiety, or maybe recovering from like a stroke. These are all exercises that could possibly be done. So, enough of my soapbox. Let's get into it. Draw in, bend the knees. Now, as I focus my hands towards the third eye, again, I go a little deeper with my intention. I think about the pineal gland right in the center of the brain. Turn the hands, push down, return back to a standing jaw jump position. As I do this, I'm cycling energy in through the third eye and allowing my heavenly Dante, my astral, the pineal, to be thoroughly engaged. So I relax. You can follow along physically, but think about mentally what's happening in here. And it might help to think about the Logan points, gathering energy from your environment into the third eye. Feel the pineal gland and allow that to help realign from there back through the rest of the body. Yeah, you might feel a little bit of warmth in your palms. You might feel a tingling sensation enter in from between your eyes towards the head. You might feel kind of a swollen kind of pulsating sensation might be in time with your heartbeat. All those are common sensations I've had people tell me that they feel. So just take note of them. Be aware of them. And see if you can acknowledge them and cultivate those, curate those into just everything you're feeling as you do this movement. Because again, it's one thing for you to follow us as we show you these movements. It's another thing for you to actually feel something and to be able to continue to feel something so that you can use it in your practice. Okay, one more time. Very good. All right, Sibu, back to you.
So just kind of as an interesting aside, everyone knows what the yin yang symbol looks like, right? It looks like this. If you didn't realize this is a universal shape, that's how your body is supposed to look to be ideally in line with the Tao. So that's why your knees are slightly rounded, the chest is rounded, chest is hollow, back is rounded, is because that follows that shape. And so as you practice, keep that in mind. The body has to be in that shape all the time. So that means what? The back is rounded. The bottom has to be tucked in. The knees have to be slightly rounded and hollow. Okay. And as you practice, that goes up and down and it moves the chi throughout the body. All right. We're going to do one other one. That's draw chi to, let's do it to the lower dantian. So lower dantian is one that is where your navel or your lower abdominals are, okay? So you're going to draw the chi from the side, and as you bring it in, you're bringing in toward your hand. See if you can feel the chi on the back of your hand, okay? And then as you do that, remember you're rounding and straightening and rounding and straightening each time as you do it. So you again, your body is pumping, but at the same time, imagine drawing energy from your environment toward yourself. Okay, this is draw chi to the dantian.
Yep. All right, so let's go ahead and give this a few goes. Again, I'm going to explain what I'm feeling at least. So standing Johnson position, hand to be over each other. I'm just going to start with my right hand going. So my left hand's on top of the right. I'm going to bend the knees. I'm going to turn my waist a little bit. So the hand that goes, I watch it a little bit from peripheral vision. And I turn my my waist, I close my right quad a little bit. As I realign, that hand comes back, gathering from, again, the logam point towards the dantian center of the earth dantian here. And as I do, I might feel the warmth of my hand against the back of my other hand here. Before they touch, the other hand's going to slip through. And I close now the left quad as the left hand goes. My weight even transfers a little bit to the left side. And then it comes back, realign back, going back to center. Again, feel that have the hand come back over the other hand. They don't touch, they get really close, but I can feel that warmth in my hand. And then that right hand slips through. To the right, slightly. But again, keep your hips facing forwards the whole time. Bend the knees, and then as I draw back in, I strain the knees. Compressing again that fresh energy, drawing it into the earth dantian. And again, this hand's going to slip through. Bend the knees, and then as I strain, I draw back in. Okay. So this helps nourishing, again, your earth dantian, but it can also be used, depending on your level of engagement and your intentionality. You can also be bringing energy from, again, astral or the heart. And again, helping replenish that storehouse of your energy in your body. Gather. In, let's do last time. So right side, left side. All right, very good. Okay.
So you can think of these exercises as both tune up for your engine, if you like, your body, or as ways of dealing with specific diseases or illnesses. Okay. The drawing chi the dantian exercises here are to nourish your body. So generally, it's good for your general health. So the way I recommend you use this is this way. And I explain it to the students the same way that you go to see the acupuncturist, massage therapist, do cupping or whatever you do. That's to open up the body, soften up to allow for the circulation. But if you want to heal, you do the Tai Chi and the Qigong exercise because once you open it up, when you do the Tai Chi and Qigong exercise, the energy will then even more rapidly move through your body. It will help the healing process immensely and you will heal much faster. And you have to tell the patients that my job is not to heal you. My job is to help you heal yourself. And I think that's kind of important to remind people. Chinese medicine is not like Western medicine. It's not you have a problem, let me stop it right now and fix it for you. No, it's a long process because you have to heal the body in order for whatever's going on to go away. And so the Qigong and these breathing exercises help you to heal. It helps you to move the fluids through your body. It helps the regeneration process. It activates your 12 meridians. It nourishes all the internal organs. So those are really key things to remember. So these exercises that we're introducing can be done by anyone. Okay. And some of them's more specific than others. Okay. And I think we're at about almost the 3/4 mark. So I'm going to move on a little bit because there are a lot of other Qigong exercises, but I think these will be good ones. I think when I do another session, I will introduce some other ones, but these are like really the key ones for you to practice, but also to tell your patients about. The next part, these are movements from Sun style Tai Chi. So to practice Sun style Tai Chi just for health and wellness, the form, of course, helps, but practicing the movements individually will actually help even more. Okay. And so all the principles we talked about, hollowing the chest, pulling up the back, tongue touching the roof of your mouth, all apply as you practice this. So we're going to do that, but we're also going to do something else first, which is moving. And I don't often get a chance to do that because I can't actually demonstrate that to you, but Mason has a good camera you can watch. So if you go to PT practice, this is something that PT makes you do all the time, especially if you've fallen down, you have knee or ankle injuries. This is the first thing they teach you. But this is also Tai Chi. So what am I doing? I'm standing with my feet kind of in a V a little bit. I'm going to walk. How? I'm walking sideways. So I put all my weight on one side, step out, touch my toe, shift my weight all the way to this side, bring the foot over. So if you've ever done PT for your legs, this is the first thing they teach you. And if you want more exercise, they make you use elastic band. That's also okay. But let me have Mason take you through that. We're going to walk across the room both ways, and then we'll move on to the next exercise.
I got a little started there already. So you can join me if that's the case. So as you can tell with my white socks against my blue mat here. So welcome to Tong Dojo, I guess. All right. From the space that you're inside, just make sure you have enough room to move about. And if it's a few more steps, it's okay. Just repeat what's possible for you. So I'm just going to start with my feet in a V shape. So the heels are a little closer together. They don't have to touch necessarily, but I'm starting in this position. I'm going to bring all the weight to my left side. So I'm yang or full on my left side, yin or empty on my right leg. So that allows me to lift that foot. I put my ball of the foot down, or again the heel, either one's fine, but I'm going to put the ball of the foot down. Then I put my heel, all that weight shifts over. I feel myself shifting what's yang and yin, so I'm full now on the right side, I'm empty on the left foot, so I can draw that foot in, compress the core, that leg comes in, and then come back down. In this position, I try to keep my head level. That exchange of yin and yang is happening. So now I'm full on my left side again, empty on the right. It can make contact. It can plant and root. So the terminology there, contact, or you, again, you connect, you join and adhere, and then follow through your body, rooting into the ground so that you can smoothly transition into the other leg and break into the other position here. And you can have your hands on your side or your hands on your hip. I'm just going to have my hands on my hip. Out, connect, join, adhere, and follow through the earth. Back in. Good. Let's go the other way again. So all the weights on the right side, left side is empty. But this time I'm going to show you my heel. So I'm going to put the heel down, toe down, and then go. So either one's fine. Depends on what you're working with your clients. So again, you all know different points of your feet that are engaged with different organs in the body. So you can kind of prescribe what might be a good way for them to move that activates different organs related to the feet. This one, of course, I'm just doing the heel down first. And then I put the ball of the foot down, and then I shift over. Again, you can do it either way. So anyways, Steve, back to you.
So I want to remind you, if you prescribe this to a patient, this actually, there is a medical code for this. So this is PT for a patient, for instance, who has problems with balance. They're infirm in their legs, they're weak. This is something you can prescribe and can be paid for. So keep that in mind. So now, the other thing we're going to do, however, to make it a little more complicated, is add the arms. So the arms are wave hand like clouds. So as you step, you're going to move your hand and step back and move it again. So let's follow Mason doing wave hand like clouds. Again, this you can prescribe as a PT exercise and can be used as such. Keep in mind, you should also remember what? The body has to be straight. They have to shift all their weight to one side before they move. This is how you improve their leg strength, but also improve their balance. So there's less likelihood that they will fall. All right, Mason, please.
Yeah, a quick adage there too. We fully acknowledge there are multiple ways of doing wave hand like clouds. There's not one way of there because there are multiple different Taiji styles. You have, of course, your Wu, Hao, Zhao Bao, Chen, Yang. This is Sun style. I'm going to stay in Sun style. As Sifu said from the beginning, we are, for the purposes of this session, predominantly talking from Sun style because of the correlation to Dr. Paul Lam's research, and also Mason's own adage is that I like Sun style because it relates to my Bagwan Xingyi topic for a different time. But again, we're going to stay in Sun style as how we do this for now. So what it means is that my hands, you see the center line of my body, from the belly button to the nose, the hands are going to be out along the center line. The other hand's also going to be on the center line, but the level of my earth dantian. So the level of my heart, it's the astral, and the level of my earth dantian. And then as I turn my waist, that allows me to move the hand. The hand's going to continue to round out, so they make kind of like a rounded curve that allows the hands to pass over each other. And then I make an oval, so not just rectangular, because in Yang style, they do kind of a rectangular movement here. Okay. Sun style, because the hands don't rotate here, they rotate by making a circle. They're both always on top of each other, but I'm over exaggerated. Just kind of make it like a big circle like that.
So keep in mind, if you watch Karate Kid, it's wipe on, wipe off, literally.
Yes.
Okay. Imagine there's a mirror in front of you and you're polishing the mirror with your hands. Okay. So that's easy to remember. And also that the hands cannot be higher than your head, have to be about the height of your eyebrows. Okay. Lower hand has to be near your the lower dantian. Okay. Just below the belly button. Okay. That's where the two should be. All right. Let's follow Mason, please.
Yeah. And as you notice, I grabbed the scarf, like a lovely scarf at the NCCAF event, just to kind of show you how they make this kind of circle. But anyways, I want to just briefly explain that before we begin so that we're not just missing out on what's going on with the upper body. But remember, incorporate this what we just did with the legs, and you have yin toe, wave hand like clouds. Arguably one of the most important practices in Tai Chi. So let's give this a go. I'm going to go to the left side and then I'm going to the right. Don't worry if you get the wrong side because we are doing both. So if you go right and left, it's okay. So starting here, position here. I'm going to stay stationary for 1, and then I'm going to move 3 times total, but I'm going to go to the left. Okay. So stay where you are, circle 1, and let's go ahead and step on the second one. So my hands alternate. I'm going to shift in. As this hand dropping, I'm imagining that I'm sinking into my right leg as my right hand drops. Left hand rises as the left hand leg rises. I step out. Again, I'm just going to put my ball, my foot down, and then my heel, and then I shift across. And the hands, again, follow that center line. And then as you say that, as my left hand drops, my weight sinks. I'm yang on my left foot so that I'm yin on my right, so the right foot can come in. And then I shift across. See that? Let's do it again. Alternate the hands, step out. Again, I can put the heel down. That's okay. That's also works. You just know which one you're doing. And then I put the ball foot down if I want to do it the other way. Cross. Again. Okay, let's do it again. I put up the ball, the foot again. Either one works fine. I'm just letting you know what I'm doing. You can stick to one or the other based upon what you're working with your client. Okay. Now, let's go back the other way. I'm going to do 1 rotation like that, just stationary. Step out and go. Back. Okay. And it's important, you don't have to have them step so wide that they're forcing themselves to use a lot of external movement. Just enough is so that you can move, and it's going to be based upon your client. They may not have a lot of range of movement, and that's okay. All right. That was going back and forth doing wave hand like clouds. Sibu, back to you.
Okay, and the other thing to kind of understand about that, as you're turning, you should try and mention to the patient that they need to engage the abdomen, because as you finish this, how do I draw this leg over? I use my lower abdominal muscles. I lift my empty leg up and draw it over, okay? So the pulling is from the dantian. It's not from lifting your leg using your leg muscles. So that's the main mistake people make, is that they actually use their legs by lifting their legs, but you're not lifting your legs with your leg muscle. You're lifting it with your dantian. The lower abdominal muscles pull up and bring your leg over. So that's an important distinction. Otherwise, it becomes purely a physical exercise, and it's still not Tai Chi yet, though it's okay, but it's not very, I shouldn't say very effective. It's not as effective, okay? So that's the difference between doing medical Tai Chi and just doing Tai Chi as an exercise, okay? Tai Chi as exercise, yeah, you can just lift your leg and bring it over. Not the same thing, okay? And again, as I said, there is a medical code for. You can prescribe this and get paid for teaching this. All right. So the next thing we're going to work on is the open and close, and then the single whip, because this is important for the lung. So people who have asthma, diabetes, who have allergies, sinus problems, digestion problems, this is very good for them. So we're going to use the same open and close we did earlier, but now we're going to sink into one leg, stretch the leg out, push out, pull forward, and now you drop the elbows and arms and sink, and you round the quad area, okay? That allows you to connect your upper body to the lower body, okay? And the chi then can rise up from the ground, because as you sink into the ground, the energy comes back up from the ground through you. Okay, so this again is another way you can prescribe for patients with, again, heart problems, even leg problems, balance. This also helps. Again, you need to what? Stress that weight is on one side. I step out and then I slowly transfer it to the other side. All right, let's follow Mason. This is Kai He Gong to Dan Bin.
Yep. So I'm going to do it closer here so you can see me again with my socks. Look, I'm up. Like we did before, open, close. This time I'm going to turn the hands, the thumbs are down. I'm going to push out in front of me. I'm now becoming full on my right leg, empty on my left. And the core is going to compress. That lifts the leg. And I step out. Put the foot down, whether it's the heel or the ball of the foot, either's fine. Separate the hands. And then I sink, turn the elbows down so they kind of go rounded. And the elbows drop. Okay. But we can come back the other way. Come in. You step in to back to your same position here. Open. Close. And now turn the hands. All my weight's already going to my left side so that as I push out, I can press the core. Lifts the leg. My hands slide across this line in front of me. I drop the elbows. I'm in done being a single whip on the other side. And then just to get back, bring all the weight, melt it away from the left side. Let it form all the fullness, yang energy on your left leg so you draw your other foot back in. Okay, so again, one more time. Open, close, single whip, dan bien. Come back. And then last time on the right side, open, close, dan bien on the right. Okay, very good. Come back to center and Sequel, back to you.
All right. So, couple things to remember. The hand is out in front of you. So it's not over here, it's in front. And when you're doing this, imagine there's a pole here. You're sliding your hand along the pole. Now, if you keep sliding it, you're going to drop up your hands off the pole. So as you get to the end, you sink, you continue contact with the pole. Okay? Your hand never leaves the pole. So you can make sure that the hands don't do this and drop. Okay? Because the pole is right in front of you. You have to keep in contact with it throughout the entire exercise. Okay, that is the correct way to do the single whip. Many students don't pay attention to that and they end up looking like this, okay, or like this, but the hand is in front. Again, imagine there's a pole here. You slide along the pole and then you keep contact with it as you drop your arms. So there is a distance you can go out. You go out too far, okay, you lose contact with the pole. So that's important in terms of how far do you go out. So again, that's good for your heart. The other thing we haven't done yet is walking back and forth. So we're gonna do carry tiger to the mountain right now. So your hands are at your sides. Again, you're gonna sink into the ground. So sink into the ground. As you do that, your arms automatically begin to come up as you go down. Okay. So my body sank down toward the ground as I open up the legs below. Okay, hands come up. I step forward and I push. Okay, so to step forward from this position, my heels come forward, shift my weight to the toe, and I draw the back foot up and push. Then I drop my hands down, step back toe first, raise the front toe, bring the foot back, and return to Jianzhong. All right. So Tai Chi stepping utilizes heel to toe stepping. Okay. I'm going to have Mason do 2 or 3 steps forward and then 2 or 3 steps back. Okay. So
Okay.
this is what the internet rage right now. Tai Chi walk. This is the correct way to do the Tai Chi walk.
Yeah, Tai Chi walk, right? Okay. Just remember, folks, there's no such thing as a shortcut silver bullet to everything. It takes work. It takes practice. you can feel the sensation, and that's obviously what you want. But remember, try to help your clients see beyond the internet fake craze. Okay, so what I mean by that is that this is going to help you develop control of how you're stepping. So I'm in my standing tall position. I'm going to bring all my weight to the left leg. As I do, relax the arms. They're going to naturally float up. As I deposit my yang energy, my fullness into the left side. Lift by, again, compress the core. That raises the leg. So it's like someone's kind of lifting you by the knee by plucking a string attached to it. You should feel that sensation. I'm going to put the heel down, ball the foot down, and all my weight's going to roll and melt into the front leg as I push forwards. And I lead with the fingers. I press with the rims of the palms as I do for Tiger to Mountain. Now, extend the hands forwards. I'm going to put the ball of the foot down as I reach back. See my mirror. You also see how my foot's here. It's not the toe, because the toe is notorious for getting broken. So put the ball of the foot down. The toes support that. Draw in, and you again put the heel down. You roll down, feel yourself roll into that back leg and down. Good. Let's try the other side. It's not too bad. Ask questions if you have any questions. Let's do the other side. Up. I'm now yang on my right side, yin on my left. Press the core that lifts the leg by the knee. Heel toe. Push, again, leave the fingers, apply with the rims of the palm. Extend the hands. Reach back with the ball of the foot. Make purchase to the ground, put the heel down. So I'm connected, and now I join together with the earth and adhere to how my body needs to be so I can follow through down. Let's do that again. Up. I'm all full on my right side, empty on my left. Put the heel toe down. I step, and then I follow step. Stand. Reach back. Connect, and then root into the earth. Down. Then again. Side, I'm full on my left side. Right foot touches the earth. With the fingers, apply with the press with the rims of the palm. That does the push. Reach back, heel, and then is on the ground now. There. Turning back to your Janjo position.
Okay, so I hope that's kind of clear. The other thing, though, which is also true, it is not true what the internet says that after 6 weeks of this, you can have a six-pack. Okay, right? So don't believe that.
Yeah.
But practicing the Tai Chi walk like this will strengthen the legs, help with balance, help with general mental and physical health. Okay. Next, we're going to do what we call draw Qi to the Dantian, also sometimes known as beginning Tai Chi. So most people do beginning Tai Chi. They just raise the arm up and drop it down. Actually, beginning Tai Chi has more parts to it than that. There are 4 basic energies that are part of beginning Tai Chi, and you need to experience all of them. So feeling the energy for that is important, number 1. Number 2, feeling the energy helps, again, as I said, the body to heal. So this is drawing qi from the ground to the dantian and sending it back down. So your hands are right now your feet are shoulder width apart, hands at your sides. As you raise the arms, you lower the body. So body lowers, hands come up to your shoulders. From here, you're going to straighten your legs and reach. Send your intention out as far as you can. Then from that far away place, draw the chi back toward your lower body. You get to your sides here, your hands are still in this position. Push down with your palm, float yourself up. So now you have that floating sensation. You also should feel your fingers tingle a little bit as you do that. So again, raise the arm, lower the body, push off the ground, extend. Draw in as you bend the legs again. Push down as you raise yourself back up. Okay. So this is the correct way to do beginning Tai Chi, to use it for health and medical application. So this uses the 4 different energies of Tai Chi. Peng Lu Qi An. Peng to expand. So you're trying to fill everything, right? Qi to reach out. Okay. Lu to pull it in, and An, lowering it back down. So the energies are circulating in all directions. All right, let's follow Mason, please.
Yep. They say that the beginning Tai Chi is like the most important one to do. So let's give that a go. All right. So I'm gonna be in my standing Zhongjing position and keep the lower lumbar straight. Feel the chassis of in your lower pelvis and the torso. Fold it in a bit. So bend the knees, the hands come up. Extend the fingers forwards. Feel your yi reach the fingertips, but go beyond that even. See that draw in through the arms, relax the elbows. Back down. Feel yourself realign back to standing position. Let your fingers point back down so they return and settle into a neutral position. Okay. Beginning Tai Chi. Raising Chi to the Dantian. Stand with your intention, your Yi. Relax, draw in energy like your arms almost like a vacuum cleaner, sucking air in. Settle palms, relax the wrists. Again. So as you're doing it, it's not just following the motion, as we said before. What should you feel? Ask yourself, what do you feel? I have the tongue pressed against the roof of my mouth because I want to feel the renmai. I want to feel the center line. And up and out. In, down, back to a Jandong and Wuji state. Okay, super. Back to you.
All right. The last one is turtle. Turtle is an animal. We borrowed this from Bagwaja and Xingyi. Turtle, or the character, is beet in Chinese. Beet is actually a soft shell turtle. So you kind of think of this as the shell of the turtle. Your head is looking over your shell at your opponent. The hands make a T. Okay, like that. Oh
Just
yeah,
like this.
yeah. So you're kind
Hey.
of glancing over at your opponent here. Okay, but
Yeah.
this is your shell, so you have to make sure that you don't bump into the shell. Okay.
Mm-hmm.
Now, to get into it, I'm standing sideways. I'm just going to step sideways. Okay. So we're using the same step you use in wave hand like clouds. So all my weight goes to one side. And as I shift my weight, my hand comes up. I draw the other foot over. And as I do that, I push out to the side. And you notice hands are in a T. Okay. Now I settle all my weight on the left leg. I step out with my right. I slowly shift my weight, and as I finish, I draw my foot over. Okay. And again, sink all your weight here, step out, shift, and push. So when your leg comes over, you must push out to the side. Okay. It's slightly at an angle, like about 45 degrees. Okay. Not exactly sideways. So it's at the corner. Okay. All right. Let's follow Mason. This is the animal called turtle.
Yeah, you gotta love the fact that I actually have a little model of him. And he's doing the motions. You can see the hands kind of turned. So all that being said, just for fun, by the way, this is a wonderful gift that I love, by the way. Um, is that as we do the movement, again, similar to what we just did, but we're now going to go side to side again with the movement, and you turn hands this way. We like to go on a diagonal too at times because we've done forwards, backs. So I'm going to go on a diagonal for one, and I'm going to go sideways. So, all right. So I bring all the weight to the right side. Hand comes up. Left hand is up. Right hand's by my elbow. I'm a step, heel, toe, but I'm going diagonally here. And as I step and then fall step, the other hand rotates and goes outwards, pushing at the level of my chin. The other one, the diaphragm here. And I go outwards. My hip still face forwards, but my waist turns slightly as I do that movement. Rotate. Now, to go the other way, I'm going to go kind of like in a box. So box turtle. I'm going to go to the right. I turn the hands almost like they're a circle. I'm going to step to the side. Turtle to the right side. Okay. But now, alternate the hands. You know, funny enough, you can actually go, guessed it, yes, diagonally backwards. So I'm going to go diagonally backwards here. Turtle to the back corner. Turn the hands. And I return back to where I started. Here. That was like a square. So, box turtle. Turn. Now let's repeat again. Go forwards to the diagonal. There. Turtle to one corner. Turtle to the other corner. Alternate the hands. Gonna turtle back. Turtle here. Hey, very good. Sipa, back to you.
All right, very good. So keep in mind the position of the hands. This is a T. Okay. And so the hands kind of point up and down at each other. Okay. All right, what we're going to do next is we're going to connect all of this. Okay. So now keep in mind for most patients, they don't need to learn a whole form. But if you have a patient who's fairly healthy, had an accident or something, wants to work on his balance and his strength, that's what you use this whole form for. And it's fairly simple to do. Okay. So you can start with your feet in the V. Okay. Put all your weight on the right leg and step out. And now you're going to do raise chi to the dantian that we did earlier. Reach out, draw back, float yourself up. And next, sink again, raise your arms, carry tiger to the mountain, step forward and push. Bring the hand back in, open and close. Single whip. Okay. Step back with your right foot and right hand. Wave hands twice first. On the third one, step out. So this is your second wave hands. Step out a third time. Now you finish the third one. Now the fourth one, you do turtle. You just step and push to the side. Okay. Next, you're going to go back. Okay. Going back is just easy. You just step back, open your hands, and wave and go back. Okay. And then on the third one, again, you do turtle. Okay. From here, you just bring your hands down. Bring your hands together. Okay. My feet are still together. Step back. Turn the hands over. Phoenix fists. Step back again. And Tai Chi. Okay, now there are many different variations of this that I have, but this is the simplest, easiest one to do. Doesn't require any complicated extras. Everything that we did today is included in this form, okay, except for the closing part. So the closing part, again, you're here when you finish, you bring the hands down, you bring your hands across, I should say. So you're still facing forward, you step back with the right foot, step back with the left foot, and end Tai Chi. Okay, so let's follow Mason through that.
Get up together, folks. So, they also call this Sun 6. 6, like a 6 digits. 6. S-I-X. All right. Step out. Open. Close. Step out. Single whip. Step in. Wave hand like clouds. 1, 2, 3, Then turtle the side. Now do wave hand like clouds going back. 1, step 2, 3. Now I'm going to turtle to the side again. Really need a lot of space. Now step back, cross hands. I'm going to turn the hands over into the X. We go from 7 star to Phoenix stance, by the way, if you must know. Relax the hands, and that's it. Very short. Right? And with that being said, I know we're coming up to time here. So Sifu, Dr. Wong and Sydney, thank you.
Yeah, so that is a simple application of those 6 techniques that we taught you. And as I said, each of those techniques can be used for different applications for general health. And so I generally would recommend for most patients, after you've had them you've done your acupuncture for them, recommend 1 or 2 of these for them to do to help speed up their recovery. So that's one way I would use it. If there's specifics, there are enough specific things that I've given you that you can actually use this for multiple different illnesses and applications. So I hope you found that interesting and useful. And I'll be here to answer any questions if there are any questions. Other than that, I want to thank you all for attending. Wish you good health, wish you safety, wish you prosperity and health. Thank you very much.